This is a robotic shoulder, but inside it are human cells undergoing a vigorous exercise routine. This setup has been developed to mimic the conditions of the human body, where cells can be pushed and pulled and stretched in different directions. If it works, one day human patients could be treated with tissue grafts grown in robots. Growing cells in a lab is easy enough. They need nutrients, oxygen, and something to grow in or on. A Petri dish, for example, can give cells everything they need to thrive. For Pierre Moutuis, however, a Petri dish wasn't quite enough. Pierre wants to grow tendon cells, the tough bits of tissue that connect muscles and bones. He hopes lab-grown cells could one day be grafted into human bodies to repair tears in shoulder tendons, for example. But there's a catch.
We are still far away from a fully functional tendon tissue grafts, and we think that partially this is because we are not providing the same complexity of mechanical stresses around those cells.
A Petri dish is not the natural home of a human cell, and it seems that some cells need an environment that's a little bit more stimulating.
What researchers have shown for a long time now is that external mechanical stimulation is really key to mature the tissue properly and to have the cells express the right type of genes and to produce the right extracellular matrix.
Instead of a Petri dish or bioreactor flask, researchers grow tendon cells on stretchy plastic scaffolds, with fluid providing the oxygen and nutrients. This small chamber is Pierre's team's new flexible design. So far, scientists have used repeated stretching and relaxing to stimulate the cells to grow properly. But unidirectional stretching like this is pretty different from what tendons would experience in a real shoulder.